Well, good afternoon, everybody, and welcome to Let's Talk About Health. My name is Brian Wong. Thank you. We've got some very enthusiastic crowd over here. This is our third session for this afternoon, and today we are here to discuss the recent children's vaccination developments. So, before I go into that, I would like to invite our guest speaker for today is Dr. Wycliffe Wei. Wycliffe.
Hi.
Yeah, I fall into bad habits, so I said Wycliffe and then Wycliffe.
Oh, that's fine.
Okay, so Wycliffe, today we are going to talk about this children's vaccination, but there are some facts and recent developments that I'd like to share with everyone here as well as on MeWatch. So, from 25th of October onwards, children between the ages of 6 months and 4 years will be able to receive the Moderna or the Spikevax vaccine for their primary vaccination. And the point number 2 is that the recommended Moderna and Spikevax vaccine dosage for this age group is 2 doses of 25 micrograms each, spaced 8 weeks apart. And while the vaccine from the Pfizer-BioNTech community, which is a 3-dose vaccine for children aged 6 months to 6 years, has also been approved but still waiting delivery. So it should be available by the end of the year. And the children between the ages of 5 and 11 will be able to receive the Pfizer-BioNTech community vaccine as a booster dose. And it goes on. From October 18th, which is next Monday, parents or guardians of children aged between 6 months and 4 years may register their interest for their child or ward to receive the Moderna Spikevax vaccination via http://child.vaccine.gov.sg. All right, so Wycliffe, can you just share with all of us why is it important for children between the ages of 6 months and 4 years to be vaccinated?
Okay, so I think why we are offering a vaccine is really to protect against severe disease from COVID-19. As we know, COVID-19 is still with us, and there's a kind of a new surge that we are kind of seeing even in Singapore. So yes, we know that children. Some people say that actually disease in children, COVID-19 is actually quite mild in children. So it is true that COVID-19 generally is not severe in children, but we do still see severe disease happening in children. So that things can be like severe lung infections or pneumonia. It could be what is known as a MISC or multi-system inflammatory syndrome. Right, there also could be ICU cases requiring intensive care, where you need tubes into the lungs to help to breathe. Right, and there's also there have been deaths even in the younger age group. So I think if you have following the news, there are probably about 3 cases that have been reported under the age of 5 years that have passed away for COVID. Okay. Yeah, so I think in order to protect against the severe disease that we are seeing, it is important to give to have our children really vaccinated. And also in terms of hospitalization, so for our 6 months to 4 years kind of age group, in terms of the young children, actually they have higher hospitalization rate than slightly older children, right? So it's also important to give the vaccine to reduce the risk of hospitalization. And indeed, in children 5 to 11 years old, vaccinated children have 80% less risk of hospitalization than those who are unvaccinated. So all in all, vaccines are important to prevent severe disease even in the youngest of our children.
Right. I'm not a parent myself. I don't have any kids, but I've got friends with kids, and of course, they are kind of worried. They're kind of on the fence about it, whether they should get their children to be vaccinated or not, because there might be not much research to show that it is safe, and they might also think about the fact that as adults, when we take the vaccine, some of us do have very strong reactions to it. The aftermath wasn't so enjoyable, so they are worried about the side effects for the kids and whether they are able to handle it as well.
Okay, so I think in terms of safety, there has been research done. So they do human clinical trials in children. And in fact, what they observed is that the side effects are actually mild to moderate, right, lasting about 2 to 3 days if the child do get off the vaccines. And the common vaccines, common side effects are usually, injection site pain, some swelling, some fatigue, some of kind of muscle aches, and then some do get fever as well. So quite similar to what you expect in adults. In terms of safety-wise, so in a clinical trial, they did not observe any severe adverse events, right? And also in actually, we are not the first country to actually give our children vaccinations. And in fact, the US has actually vaccinated more than 1 million children 6 months to 4 years, and therefore, and no safety issues that have been identified. So, based on the data we have, based on how other countries have actually rolled out the vaccination in a very big way, I think all the data do indicate that this vaccine is safe even for 6 months to 4 years.
Okay, just in case you must be wondering who is addressing all of us now is we have Dr. Wycliffe Wei. You are from the Ministry of Health. You are a public health physician. So that puts you in a very good position to answer a lot of questions we have on the aspects to this COVID vaccination for children as well as for adults, and later on we'll discuss. So for children, right, how many shots do they actually need minimally to protect themselves? Because for adults, we have the first shot, the second shot, as well as the booster shot. But now we have another booster shot, which is a bivalent one, which we'll talk on later. So let's touch on children first.
Okay, so when you talk about minimum protection, I think for adults, we are saying that a minimum protection is 3 doses. But currently for the youngest of age groups, which is the 6 months to 4 year age group, currently what we're recommending is 2 doses of the Moderna Spikevax vaccine. And this is for the primary vaccination series. So yeah, we are recommending 2 doses of the Moderna vaccine for this age group.
Okay, so what are the possible side effects from vaccines for children? So how do we manage them?
Okay, so I think so the main common side effects will be, like I mentioned earlier, will be injection site pain. Actually very similar to adults, right? So the injection site pain, the fatigue, some people get headache, some got muscle aches, joint aches, right? And some might get fever as well. So generally, this lasts for 2 to 3 days. As with adults, you just can't go away with itself. You just need a bit of a rest. Sometimes, if you could take paracetamol as well, could give your child paracetamol as well to help with the fever or the pain that he or she is experiencing. But otherwise, it's nothing really to be concerned about. However, of course, if it persists or it gets worse, that's when you want to kind of see a doctor to make sure that there isn't something else that is going on.
Okay. Yes, as adults, we are able to handle the pain or the discomfort, But some parents might feel that because if the baby is, let's say, 6 months or to 4 years old, maybe they are not able to express themselves well enough to let the adults know how they are feeling, because some people, like what you say, may experience the very general kind of a side effects, perhaps, some areas at the arms and where the shot is at and stuff like that. But there are people who experience things such as the tightness of the chest, so on. So how do we navigate that?
Okay, so in general for young children, I think in terms of general medical care, I think as long as the child is happy, feeding well, interacting well, playing well, these are signs that the child is doing fine, right? And that's when you don't really need to worry. But it's when the child gets, very withdrawn, become very silent, not really eating, not drinking fluids well, not playing, not being interested in the usual things that the child is not playing with. That's when you probably need to be concerned, and that's when you want to probably see the doctor to review your child.
Okay, so is the booster compulsory for kids that are like 5 years old to 12 years old?
Is the booster compulsory?
Yes.
Okay, so no, it's not compulsory. So it's vaccination is voluntary, right? So and there's no VDS at this time. So and definitely we have not imposed VDS. In fact, for children 12 years and below. So yeah, yes, it's not compulsory, and it's going to be something that's voluntary.
Right, because initially, just like dengue, they have said things like, "Oh, 有江湖传言," like everyone is circulating that, "Oh, if you kena COVID already, oh, you won't kena it again. That's why you don't need a booster shot." So, is it true? I mean, some parents must be thinking, if my kids caught COVID and recovered, do they still need 3 doses?
Okay, so this is for children who are aged 5 to 11, so we are recommending 3 doses at the moment. So for recovered children, so if they have already received their primary vaccination series, their first 2 doses, so we still recommend them to receive the booster dose or the 3rd dose even if they have recovered. And we are actually recommending that they take it 3 months after the infection, so not immediately, because as you say, you do get some kind of protection, right, in the immediate period. But after that, that's when immunity may go down after recovery, and you still want to maintain it at a very high level. And in fact, scientifically, we often are very interested in what we call hybrid immunity. Hybrid immunity meaning there is a combination of immunity from past infection, not only past infection, but also from vaccination, and that gives you one of the best kind of protection against COVID-19. So therefore, it's still beneficial and still going to be something added protection for the child to receive the booster, even if he or she has been infected before.
All right, so that's all the information we have, but also one more question. If the kids are taking flu jabs yearly, should we prioritize COVID jabs or flu jabs moving forward? Because kids' flu jabs, if they are below 5 years old, is free, right? So now because we are approaching the end of the year, the wet season, or they call it the flu season, right? So what should we do for the kids? Do they take the COVID shots or they take the flu jab? What's your recommendation, or what do you think?
Okay, so actually my recommendation would be to take both. So you can take both vaccines. We recommend that if you're taking other vaccines, in fact, to keep a 2-week spacing, right, between the COVID vaccine and the non-COVID vaccine. And in fact, a lot of children who are 6 months to 4 years, they would have actually other childhood vaccinations like mumps, measles, rubella, diphtheria, tetanus, pertussis kind of infections. So there are lots of other childhood vaccines that young children need to go through, and we do not recommend that you skip. In fact, you should continue to take these vaccines. But just guidance, what we recommend is that you just keep a 2-week kind of spacing in between, so that when you do get side effects, we know which vaccine is causing the side effects.
Well, as we know, the children, if they are from 6 months and above, they are not able to make any decisions. So it definitely is up to the parents to decide if you would like to have your kids vaccinated. It is very important to note that for you to vaccinate your children, you have to do your necessary homework to understand what the vaccine is all about and how it will affect your children. And while the best way for you to do your research would be to go online, definitely go onto MOH website, whereby I'm quite sure over there, the parents are able to find out the relevant information that you need. Most importantly, do not subscribe to any talks or reasoning from social media platforms or WhatsApp that's been sent to you. I think when it comes to our health, it is very important for us to go to the necessary and, reliable sources. What do you think of that? Yes.
Yes, I agree. So lots of people, often, you get very generic kind of hyperboles, very generic kind of terms that people say, oh, it's experimental, or it's that's been tested for a short while. But I think something you need to do is really to just beyond the surfaces of all these terms that people throw out, to really go into the data, or the substantial data that is there to show that the vaccines are safe and they are protective. A lot of data, and in fact, the vaccine, this is one of the vaccines that has been used very widely across the world, amongst the very few rare vaccines that in such a short time has been used across the world, across a large number of the population. Billions of doses have been administered, and still the data does show that it is still safe. So I think that is something to keep in mind, to look at the evidence, look at the data, and I suppose not just get swayed too much by specific terms that people throw out to influence how we view things.
All right, so that's all we're going to talk about, the vaccination for children. But now let's talk about something that is closer to perhaps each and every one of you here. 刚才我们谈的呢，就是谈小朋友接种这个疫苗的啊。然后现在呢，我们要谈的就是成年人的，好不好？ All right, so definitely it's been seriously 999 days or more since COVID-19 went on the market. And for the majority of us, we had our first dose, second dose, and then our booster jab. And now, definitely there is another booster jab. And now we have even moved on beyond what was the original vaccination. We have gone into from mRNA to bivalent, right? Because these are all terms. 因为之前我们知道的就是我们打了第一针、第二针，然后再一个 booster shot， 对不对？当然这个病情它本身它就一直在有不同的那个变化嘛，对不对？直到现在呢，他们就说呢，我们现在要打的那个 booster shot 呢，是又分成两大类的，一个就是 mRNA。mRNA 就是我们比较熟悉的 Moderna 或者是 Pfizer，OK， 这两个都是属于 mRNA 的。现在呢，又有一个叫做 bivalent 的一个 vaccine， 这个预防针。所以，现在我们当然也要了解，如果我们现在要接种疫苗，再打这个 booster shot for this bivalent， 而且再加上现在的这个 coronavirus， 它现在又变种了，成另外一个新的 ，which is called the latest。You can use your microphone. XBB.
Yeah, so the current strain that we are worried about, or the variant that we are worried about currently is XBB, and I think that might be driving the surge that we are currently seeing in Singapore right now.
Yes. Okay, so do you all remember when is your last booster shot? 你们最后一次打 booster shot 是什么时候？有没有人记得？你什么时候打？去年？哈？今年？ Okay, 所以一个 booster shot, one booster shot, how long can it last?
Okay, so in terms of the booster shot, actually the booster shot that have been given to adults, which is the third dose, right? Actually, it has shown to give very high level of protection against severe disease, and in fact, up to 1 year after, right, even through the data that we've collected so far, it still maintains at a high level. So actually, the booster shot is is actually very effective in terms of a sustained high level of protection for adults. And we expect that to be seen as well for the 5 to 11 years old. So for 5 to 11 years old, boosting would also have this sustained and high level of effect. Now, so that's in terms of the or how long it lasts. But so if it lasts so long, then how come do we need this bivalent? So okay, firstly we go back to what is bivalent,
close
right?
The mic, close.
Okay, sorry.
You have to go really close to the mic for everyone to hear you very well.
Okay, all
and
right.
you talk slowly. I may have to do a bit of a translation.
Okay.
Yes. Okay, here we go. Let's talk about the bivalent vaccines, which is for the booster jobs, which is going to be made available later this month.
Yeah, okay. So maybe I'll talk about what is bivalent. It's a new term. Bivalent, bi just means two. Valent means actually just two types of the virus. So bivalent is still the mRNA vaccine. It's still the same mRNA vaccine, but the difference is it contains half of the original vaccine and half targeting, right, that has been updated. Half of the component actually has been updated to target the Omicron variant. Right?
Okay, wait. 所以之前呢，我们打的那个 booster shot， 对不对？它就是直接的，就是 mRNA， 就是我们打的第一次跟第二次的那个 formula 来的。不过呢，因为呢，随着这个时间的变迁哦，这个病菌本身一直在变嘛，对不对？所以现在呢，是有一个新的 booster shot， 它一半它的成分一半是之前的那个妙方，也就是 mRNA， 然后它的另外一半呢，就是用来治或者是来对抗那种变种的疫苗变种的那个病菌，所以它是又可以治之前的那个什么 Delta 什么，然后它的另外一半呢，就是对付 Omicron 的，所以这个是 updated 的更新的一个版本。
对 Yeah, that's correct.
OK， 好，继续。
Yeah, so correct. So that is essentially what it is the same mRNA. It's still based on mRNA. Even the Omicron one is also mRNA, but it's just that it's like kind of a slightly different recipe to target the Omicron variant. Now, so how come we need to change, right? But actually, we do need other viruses. Actually, also do change with time. So one good example is the influenza vaccine you mentioned about. In fact, every half yearly, we actually do update our influenza vaccines to really match with the current strain that is out there. And in fact, if you look at the influenza vaccine, it actually targets 4 types of different strains of influenza or the flu virus. So it's actually not something that is new that we are updating vaccines. With COVID-19 having been through this is about the 3rd year, that's why we are also updating to really keep up with the virus.
Okay, so before we have, for the mRNA, we have Moderna and we also have Pfizer, right? So now the latest booster jab, which is the bivalent one, that is going to be made available to us is from Moderna. So for those who's been taking Pfizer for the first 3 shots, is it going to make any difference if you were to switch to a Moderna for this booster jab?
Yes, so there is no issue with switching in terms of the boosters. So in fact, for the first booster, which is the 3rd dose, and this second booster, or the subsequent boosters, actually there's no need to stick to the previous vaccines that you have received. So you actually can, indeed, you want to take the Pfizer, or you want to choose the Moderna booster. That is okay.
Okay, so when this new this vaccine rolls out, right? So it's for anyone, if you want to take the booster jab, what should they do? Do they go to the community clubs like previously, or do they have to make an appointment, or is just going to be a walk-in basis?
Okay, so currently it's open to 50 years and above, as well as persons who have not completed the previous booster dose or previous primary vaccination series dose. And for these, you can actually walk in to the vaccination center. So you just need to walk into the correct vaccination center. If you're looking for the Moderna bivalent vaccine, you should go to the MOH website. There is a listing of all the different vaccination centers and which vaccination centers are offering this Moderna bivalent vaccine. And then you can just walk into this particular centers to receive the bivalent vaccine.
All right. So does it mean that later this month, whenever we talk about going for a booster jab, we will automatically be offered the bivalent vaccines? So it's no longer the previous batch of boosters.
That's correct. So in terms of the Moderna vaccine that we are going to give adults 18 years and above, we're going to replace all the old ones, right? So we're going to replace the original ones with the newer bivalent vaccines, and it has actually happened since last Friday, which is yesterday, 14th of October. So since then, we have actually replaced all the original Moderna vaccine with the updated bivalent vaccine.
So that means as at 14th of October onwards, you are age 50 years and above, you are able to have your booster bivalent jabs. If you want to wait for the Pfizer one, this is still going to be some time before it's approved. Am I right to say that?
Yes, that's right. So the bivalent Pfizer is currently under evaluation, and I think probably will be announced when it has completed the evaluation. So in terms of, I think we have also announced that the stocks in terms of when it's going to be ready, probably more towards the end of the year. So might need to wait a bit.
Okay, so for everyone, because we are nearing the end of the year, whereby a lot of people, we are thinking of going for traveling, going overseas. All right, so we are thinking of traveling, we are thinking of going overseas. So definitely, whenever we go overseas, there are certain criteria that we have to fulfill. For example, you must have a basic of how many shots, how many doses, how many vaccinations do you have? Is your vaccination updated? So what are we moving on from here? Moving on, are we still counting the number of shots or doses that you have? Or is it based on your last up-to-date vaccination?
Okay, so I think in terms of Singapore's travel policies, I think we might have moved away from requiring people to complete certain vaccinations, right? So, but I think you might need to do your travel insurance if you, for travelers coming to Singapore, if they do not have certain vaccinations. I think that we are still referring to the basic vaccination. If you do not have that, you might need to get certain insurance, to buy certain insurance policies. I think all this you need to actually check online in terms of the Safe Travel Office, STB, ICA, in terms of the requirements, in terms of the vaccination, vaccination requirements. And also for overseas, then you have to actually refer to the country, right? The country that you're going to in terms of what vaccination requirements they have. Right, whether is it if you are not vaccinated, you might have to do certain tests. So that will be country specific, and you will need to refer to the country's guidelines.
Okay, just in case some of you are interested in knowing, if you're going to go overseas, certain countries they do need verification, and also your vaccination certs have to be notarized. So what you can do is that you can go into your Trace Together app. From Trace Together app, you can also click onto the validity of your, something like a statement of proof of your vaccination. And then it will direct you into your ICA or stuff like that, whereby then you will have your vaccination proof, but it needs to be notarized as well. That means when you go overseas and when you come back to Singapore, before you come back to Singapore, you have to fill up a form online for ICA to prove that you are actually vaccinated. So these are a lot of things that we have to be mindful of moving forward, right? So once again, let's recap on this bivalent booster that is for 50 years and above.
Yes, so I think just to recap, I think the bivalent vaccine is an improved version of the previous original Moderna vaccine, and we are actually encouraging everyone above 50 years and above. If your last booster was more than 5 months ago, do consider, we strongly encourage you to actually take up this bivalent booster. It will broaden your protection because it does cover the Omicron variant.
Okay, because today is just the two of us are talking about this, I'm quite sure that maybe some of you have some questions you would like to ask about COVID or anything about this booster shot, this bivalent shots. Any questions that y'all have? Anyone? Yes? Okay, wait for the microphone.
比如来说，好像中第二次的那个 COVID-19 会怎样？
哈？
怎样办？
中第二次啊？
没有，比如来说中第二次那个 COVID-19 的话怎么办？
如果中了第二次怎么办啊？哦，怎么办哦，医生？So if you kena COVID for the second time. What should you do?
Okay, so typically, in terms of getting COVID-19, once again, I think it's actually the same thing, right? It's in terms of how you're going to manage your symptoms. If you're well, you are, you do not feel sick, you're well, you're able to take care of yourself at home, then you should just remain at home, and you can take some medications to help with relieve the symptoms. So there isn't nothing to be too worried about in terms of getting another reinfection. And in fact, some people say that no reinfection, they might get a bit of milder disease. And usually people, the risk of reinfection is lower after you have had a past episode of infection.
Okay, next question, please.
Can you hear me?
Yes, very
Loud
well.
and clear?
Very loud.
Okay, my question is, I heard from the government, I see TV, Channel 5 and Chinese New Asia, television, the American, I don't know British, I don't know, in Singapore, the American is American, British. I talk about Singaporean. They say, according to the government, they say, TV Channel 5 and Chinese New Asia.
Yes, and the question is?
European one.
Yes. Okay.
I say, 50 and below haven't taken the fourth dose. 50, the fourth dose, 50 and below haven't taken.
Okay.
Unless 50 years old, they can take the fourth dose. If below 50 not available. So what's the problem?
Okay, so that's correct. So we are currently starting off with the 50 and above. I think why? Because with older age, the risk of getting severe COVID is greater, and that's why we are prioritizing persons 50 years and above. And subsequently, depending on the uptake, we will extend it to younger ages as well.
Okay, I hope that answers your question. I mean, just like the time when we had our first and second dose, we go by the different ages, yes? So progressively, when people who are 50 years and above, because maybe their body might not be as fit as young as the rest of the general population, they do need a vaccination first. Yes? Okay. Yes. We have a question from the front. Yes? Okay, the question is, after taking the third shot, the booster shot, immediately after, okay, so after your third booster shot, you got COVID. So, if she's going to take the fourth, which is the bivalent jab for her, is there going to be a side effect on her?
Yep. Okay, so you would not. So the side effects in terms of after the vaccination would be similar whether you had a past infection or not, right? So in terms of whether you would. So I think you mentioned that you got infection immediately after the booster dose, and I suppose you are wondering whether you would similarly get the same, experience the same thing. So I think no, I don't think vaccination doesn't really result in infection. It's really kind of a coincidence that you got infected probably around the time of your vaccination or just before.
All right. Sorry, I know you have questions, but we have a timetable to fulfill. And Wycliffe, thank you very much for sharing the information about COVID, for protecting our children through the COVID-19 vaccination, as well as the updated version for the bivalent vaccine for people who are like 50 years old and above. I think there's a lot of new information that all of us, we have to digest. But to gain greater insight into the bivalent vaccination and all, I would strongly recommend all of us, if you would like to log on to the MOH website to get the relevant information. Yes? So before you leave, we have to take a picture. Yes.